issues affecting our health sector. We have members here, our main spokesperson for health, Dr. Dayton Campbell. We have Dr. Morris Guy supporting, member of the Shadow Cabinet, and Mr. Colin Fagan and Dr. Shane Alexis. I am Mr. Wentworth Skeffrey, Deputy General Secretary of the party. And we welcome you all, and we're going to go straight into the issues at hand. And the main statement will be given by Dr. Dayton Campbell, spokesperson on health and member of parliament. Dr. Campbell.
Thank you very much, Robert Skeffrey. Good afternoon, ladies and gentlemen, and a very happy new year to you and your family. And I do hope that you stay dengue-free. The health sector in Jamaica has had its fair share of challenges. The less than adequate budgetary allocation and the free healthcare policy has done very little to help the situation. Many advances have been made by the stellar work of our dedicated healthcare professionals, from spinal surgeries, heart bypass surgeries, to even a recent liver transplant. These advances belie the reality of our limited resource, small nation, and our third world status. We thank the dedicated healthcare professionals who have been at the vanguard of our health sector. Today, however, we stand on the brink of a public health crisis, that is the outbreak of dengue. Recently, the Ministry of Health has declared a dengue outbreak. The timing of the declaration we considered late and reactive in its approach. Dengue has been endemic to Jamaica since 1952. It is a mosquito-borne illness carried by the Aedes aegypti mosquito. That's the same mosquito that carries chick V, Zika V, yellow fever, and of course dengue. So over the last 4 years, the country has been affected by 3 of the 4 diseases transmitted by this mosquito. At the height of chick V, the country took umbrage at the reporting of statistics of confirmed cases and the reality that was being faced by the population. It is clear there were no lessons learned from this situation. The ministry noted that in 2017, there were 177 suspected or confirmed cases, while in November 17, 2018, there were 412 cases. That is a 130% increase based on the last year. By we got to the 14th of December 2018, we had gone to 570 cases. That is an increase of 158 cases over a 4-week period. Or now you'd be looking at a greater than 200% increase, 300% increase, because 177 times 3 is what, 521 or somewhere there. So that's a 300% increase in the number of cases. Despite this, the minister and the ministry failed to act as the number of cases did not meet the threshold for an outbreak, but we were definitely having a crisis. And while loved ones were lost, the minister waited for a number to activate the necessary emergency programs to deal with the outbreak. In a recent article, a parent lamented the announcement having lost a child at Bustamante Hospital for Children, not knowing that there was an outbreak of dengue. This was carried in the Jamaica Star. The minister, in his own words, noted that there was a 2-year cycle for dengue outbreaks. We must then ask if the minister knew this. Why wait despite seeing a 130% increase by November 17 and an over 300% increase by the 14th of December? CARPA, in May, put out an advisory that the Caribbean should brace for a dengue outbreak due to an upsurge in the Latin America. This was carried in the Jamaica Observer on May 11, 2018, and I will share that article with you. Armed with this information, why would the Minister of Health not be proactive and declare that we are having a crisis, even if the epidemiological criteria to term it an outbreak was not met? In Cuba in 1962, dengue was eradicated. This has only been possible with a continuous education of the people and a vigilance to eradicate breeding sites. The minister presided over Zika, but failed to maintain an education program and breeding site eradication program, and is now, after the fact, deploying temporary workers to address this crisis. The Ministry of Health as a health prevention and education arm. Why would the $250 million not have been allocated from early warning to prevent the outbreak of dengue? The public education has been tardy and leave us to ask what, if any, was the budget allocated to public education before the $250 million. The country is yet to hear where are the hotspots for dengue and if there are new ones identified due to climate change or any other of the vagaries of weather. The minister and the decision makers in the ministry seem to be disconnected from the reality of the nation. Physicians in the field have been reporting an upsurge of suspected cases of dengue in the hospitals and health centers. Mild cases of dengue resemble the flu and may not even see persons going to a doctor. They will stay home and treat themselves, whether with a non-steroidal anti-inflammatory like Cataphan, Voltaren, or some may even take aspirin. This treatment can lead to death, as you are aware. Had many parents been educated about a dengue outbreak, they would have sought medical assistance or at least attempt to treat without using agents such as these non-steroidal anti-inflammatories. Such is the case of the children who had febrile neutropenia, they had fever and the white cell count was low, or dengue hemorrhagic fever, which is one of the main complications that you can get with dengue. Our hearts go out to the parents who have lost their loved ones, especially children in the crisis. The minister has reported 7 deaths, but as a practicing physician, we would have gotten reports that there are more than 10 deaths. Bustamante Hospital for Children alone, we are told reliably that they have at least 8 deaths that have occurred in that facility. The preparations at Bustamante Hospital for Children were woefully lacking and has led to the ward overflowing and the staff being overworked. That was confirmed as well by the president of the Nurses Association. The minister could have put in place additional staffing to mitigate these challenges early. An early activation of the $250 million could have helped in this case. The minister continues to operate without consultation and consensus. I am prepared to say today, if the minister, having been forewarned, had sought to have discussion with me about an early spend for dengue, even if dengue did not reach to an outbreak, I would have been the first to defend his actions in trying to take measures to mitigate against us reaching to the point of having an outbreak. We all appreciate that there are challenges in the health sector. We all agree that it requires effective leadership and management, especially to make the hard decisions. Instead of addressing mounting problems and making appropriate decisions, the minister prefers photo ops. In response to my recent release, the minister stated that I am blaming hardworking healthcare workers. I want to set the record straight, that I have never and will never blame these workers. Healthcare workers work based on policy directives and resources. Ministers drive the policy. That falls at the feet of Minister Tufton. Unlike with chick-V, dengue can directly cause death with dengue hemorrhagic fever. The deaths of this dengue outbreak lies squarely, therefore, at the feet of the Minister of Health. No amount of PR can change that. The minister waited on a dengue outbreak instead of attempting to prevent a dengue outbreak. Jamaica needs a healthcare system that works for all. That is very absent with this minister at the helm. From Cornwall Regional to KPH operating theaters being done to non-functioning elevators at Victoria Jubilee Hospital. I want to take this opportunity as well to urge all Jamaicans to play their role in keeping their environment clean. To eradicate the breeding sites, all Jamaicans need to protect themselves from this domestic pest. Eradicate breeding sites around the home. Wear long sleeves from sunset to sunrise. We urge all Jamaicans to protect their water supply and to ensure that our schools are clean as we embark on the new school year. So in summary, because I don't want you to get lost in all of it. In summary, the points we're making is 1, the ministry was slow to respond in spite of the warning that was given as carried in the Jamaica Observer on May 11, 2018 from Carpet, that the region should expect an outbreak. There has been and still is poor communication from the ministry to the public and to the healthcare professionals. You can speak to the practitioners in the industry and ask them whether or not they have received any additional information during this time period to increase the level of awareness and just to encourage them to report on the suspected cases. We're making a call for more information, such as where are the areas of the outbreak, so that the persons in these areas that are most affected can be prepared. B, for increased vector control and eradication, especially seeing that this Aedes aegypti mosquito has caused an illness with 3 of the 4 illnesses that it transmitted in this country within the last 4 years. C, for more testing to be done. And D, an important one, a lot of the persons who end up having dengue hemorrhagic fever is because their platelet count falls. The platelets are what causes the blood to clot. So we want to use this opportunity to make a national call for persons to go in and donate blood so that the ministry and the government will be in a position so that when these persons are affected by dengue hemorrhagic fever and their platelet count fall, that they can get platelets for transfusion. And we want to again reiterate the issue of the funding of the health sector. We believe that the health sector is underfunded, and we believe that greater measures need to be put in place to eradicate this vector. Thank you.
All right, thank you, Dr. Campbell. We'll now open it for questions.